Hi, I'm Nirja Shah with Missouri Healthy Schools. Missouri Healthy Schools provide students with lifelong advantages built upon early, positive health behaviors that improve conditions for academic achievement. Check out mohealthyschools.com for more info on the resources we offer. Today, we're excited to have Dr. Lauren Schwartz, Professor and Assistant Dean at SLU School of Medicine, in part one of a six-part webinar series on topics related to health and well-being. This first episode will cover the warning signs that you or someone you know may need to seek support for mental health and well-being. Welcome, Dr. Schwartz.
Thank you so much for that kind introduction. It is such an honor to share this time with you. And so without further ado, let's jump in and talk about some things that hopefully will be very relevant to you during this challenging time that we're finding ourselves in as a country. So I'm going to talk to you about mental health and wellness amidst the COVID pandemic with, as she had said, a focus on what are the signs that I potentially need to reach out to get some assistance, or I'm seeing one of my coworkers or someone that I'm supervising, we may need to get resources for them. So we're going to talk about mental health concerns in the context of the pandemic. And I really want you guys to be able to leave this webinar with an idea of, okay, what are those signs and symptoms of things like depression, anxiety, and grief that I need to be watching for, not only in myself, but maybe folks that I'm working with or I'm supervising. I really am the belief that we are each other's brethren, and especially now more than ever, we need to be watching out for each other. And then I'd like to take kind of a step away from not only talking about when do we need to be concerned, but then let's spend some time talking about how can we improve our wellness? What can I do for myself, or suggestions that I can make for others to help ourselves? I think that it's really important to recognize that this is a new normal, the quarantine. Oh my goodness, I don't know about any of you, but I never thought I would be stuck in my house the way that we have experienced it. And I firmly believe that humor is still an important part of our day, and it's great medicine. So I definitely, every now and then, need to smile and laugh about some of the funniness, you know? We have to not always take ourselves too seriously. So what are some of these unique challenges that we're going through? Social isolation, virtual life. I never thought I would be delivering wellness and mental health talks on a platform like Zoom, like we're doing right now. I didn't even know what Zoom was before March, to be quite frank. I'm also technologically kind of a dinosaur, but at any rate, I didn't know what Zoom was. I thank God for Zoom every day because it's still allowing me to meet with folks such as yourselves and provide help as I can. And I see my patients via Zoom too. So thank God for it. But also, let's acknowledge how weird this is. A lot of us are working from home, and we had never done that before. And oh my gosh, we could give a whole talk on the challenges of working from home. Some of us have lost jobs, or our loved ones have lost jobs. There's this huge fear of the unknown that we're living with. When is this going to go away? Are we going to get a vaccine? Are we going to get a treatment? When do I not have to wear a mask anymore? And I think also, especially early on, that fear of reemergence, coming back out of our houses after quarantine was very frightening for some people. And grieving. We're going to talk more in this discussion today about grief, but I think it's super important to label some of the emotions that we're feeling accurately, which is we're grieving how things were and how things are turning out may not be how we had hoped, And I'm sure each of you listening right now have many other unique challenges that you've faced either personally at home or in the work environment. So the list could go on and on. Let's talk about when we need to be concerned about ourselves or someone that we're working with. So I'm going to provide a little bit of statistics first to sort of ground us all in how frequently these sorts of concerns were before the pandemic. 1 in 5 adults in the United States experience some form of mental illness. And I have a comparison to what we would maybe call a medical condition. In my world, mental health is medical, but not everyone views it that way. Compared to 1 in 10 individuals have diabetes. I don't know if that statistic surprises you, but the occurrence of things like depression and anxiety far more prevalent than things like diabetes. So let's talk specifically about how frequently mental health concerns are happening. 19% of us will have an anxiety disorder. That's a full-blown diagnosable condition in the last 12 months. So odds are we've either experienced it or we're walking around with people we may not even fully appreciate it that are experiencing anxiety. 7% of us will experience depression in the last 12 months. So this is not a small number of us that are silently walking around with these things. When we look at specifically to the educational environment, we know that based on National Foundation for Education research, 1 in 5 teachers, so 1 in 5 of you guys listening on the call, feel tense about their job most of the time, compared to 1 in 8 workers in similar fields. So this certainly touches your profession. So I've had work colleagues and patients ask me, Lauren, how have those statistics changed that you just shared with us during COVID? Because it makes sense that during a time of intense stress that maybe the rates of symptoms of depression and anxiety would go up. So the CDC, in conjunction with the Census Bureau, has done this survey for a while now. It's called the Household Pulse Survey, and it's looking at folks in the United States over the age of 18, and they fill out a survey that assesses their mental health. So if we look past about a year ago, about 8% of folks were reporting at that time that responded to the survey symptoms of anxiety. About 6% were reporting symptoms of depression. And then 11% had kind of a co-occurrence of both of those things. And it actually is very common to experience depression and anxiety together. I kind of refer to them sometimes as unhappy bed partners, unfortunately. So this might be hard for you to see on your screen, but this is what's happening now during COVID. And admittedly, this was during the spring, but I just want to highlight, I look at the 18 to 29 just because it's kind of the first one there. And we're really seeing that the emerging adult folks are experiencing almost a triple, almost actually a quadruple incidence rates of depression and anxiety. And if you look at sort of the national average, we're up to almost 25% of individuals during COVID are endorsing symptoms of depression. So it's important to recognize that this is really common right now, and 1 in 4 people that we're walking around with are likely experiencing symptoms of depression. So what am I talking about when I'm talking about depression? I think that a lot of us have that image in their mind, oh, it's the person that doesn't want to get out of bed. It's the person that says that they want to end their life. And certainly that is depression in its severe form, but depression is different for different individuals, and the symptoms of it are widely diverse. So yes, sadness, cheerfulness, changes in sleep, too much or too little, changes in appetite, overeating or undereating, difficulties with concentration. So that's one I think that we fail to really recognize appropriately, is that our thinking skills can become very cloudy when we're in the midst of feeling depressed. Energy can be poor, lack of interest in doing things, feelings of hopelessness and guilt. And it also can be very physical for folks. Sometimes patients will explain, gosh, Lauren, my body just hurts all the time. And there's not really a physiologic explanation. It's more the depressive symptoms that they're feeling, really. So depression can be very physical. And then, of course, the one that we worry the most about are feelings of that they don't want to go on. So thoughts of harming oneself or ending one's life. And of course, that is the medical emergency from a mental health standpoint. The other thing that I don't have listed on here that I also see a manifestation of depression is irritability. So sometimes folks become grumpy when they're depressed, and that's how it's manifesting itself. I want to talk just a little bit more about suicide because I feel like it is the most important thing that would immediately cause us to want to do something in the moment if we feel ourselves are suicidal or if we are working with someone that is. And so this is a really interesting diagram put out recently by Oxford University Press, discussing during the pandemic why we might see more individuals being more vulnerable to having suicidal ideation. And so, when we think about what's happening during COVID, uncertainty, social isolation, economic problems, take any one of those by themselves and they're significant stressors. And then we see that there are more individuals right now that are vulnerable to COVID, and that this interacts with one another. And we see folks that already have pre-existing psychiatric disorders, depression, anxiety. I'm really worried about alcohol use during this time. All of this is sort of a cascade of events that make individuals potentially more vulnerable to suicide. And so what I would say to you is, if this is something you yourself are experiencing, reach out immediately for assistance. Call your doctor, call 911. I have resources for suicide crisis hotlines. And also, if you see this in a peer or someone that you are working with, I always tell folks that I would rather have a friend or a coworker upset with me because I did something about it than have someone have a bad outcome. So just kind of having that in mind, I think, is really important. Symptoms of anxiety. We all probably experience anxiety, whether or not we admit it to ourselves or to others, but there are always times where we feel apprehensive or senses of dread or feeling jumpy or restless, feeling the worst will happen. Also, physical symptoms can be with anxiety too, much like depression. So these are some of the signs of anxiety. And I said at the beginning I was going to talk a little bit more about grief. So I think that it is really important, like I said, to label some of the emotions that we're experiencing right now appropriately. And grief is an appropriate term. Grief is an emotional reaction to loss. And this is universal to all of us, right? And what does grief look like? Many symptoms of grief are similar to that of depression. Sadness, loss of interest, all those things that I listed on that slide for the symptoms of depression. And when we're in acute grief reaction, it can last for a few months. And it's very important for us not to pathologize our grief and to allow ourselves to feel those emotions. I think that we have a tendency, and it's human nature, to run from feeling unpleasant feelings. But if we don't process them, they don't go away, unfortunately. And oftentimes I am working with people to use the mantra that it's okay to not be okay right now. This is a time of great stress for all of us, and it is okay to not be okay. With grief, it can become complicated. A lot of people are losing loved ones, friends, people that they work with due to COVID. And we really all need to help each other process our grief. And it's important to recognize when the grief gets the best of us or someone that we love. So when we find that emotions are too overwhelming to deal with after we've had a loss, that can be problematic. So oftentimes we can see people keeping too busy, doing way too many things to run from the emotions. Or we can also see the opposite, the individual that sort of becomes the professional mourner, and that loss and grief becomes woven into the tapestry of who they are. And that certainly is also problematic. When grief lasts more than 2 months, it becomes a warning sign that maybe it has become depression, and that maybe it's time to get help with a mental health professional or to reach out to a primary care doctor. So I think it's important when we're talking about grief, I think we all naturally think about it as after the loss of a loved one or after the loss of someone we know, so death. But it's certainly not the case that it's only following death. We can experience an illness, things like changes in our mobility. Folks experience changes in their cognitive functioning, either due to things like memory loss or mental health related things. Divorce, breakups of relationships, loss of dreams, loss of faith, loss of trust. I mean, all of these things are associated with grief. These are losses that you can experience grief with. Specific to the pandemic, we are losing people that we love. Some individuals that are suffering from COVID certainly are experiencing dramatic changes in their health, either in the short term or unfortunately long term. People are losing financial security, loss of trust in authority figures, loss of sense of safety. People are afraid to go to the grocery store, afraid to do normal day-to-day routines that we used to really kind of take for granted. Feelings that our freedom has changed in some way. During quarantine, I know a lot of people felt like they were being restricted. And of course, that's a natural feeling. Loss of opportunity, loss of human social interaction. We're wearing masks around our loved ones. If we have people in our lives that are vulnerable, we're not seeing them at all. And I think it's also important to recognize that losses of irreplaceable experiences are happening, big and small. And what do I mean by that? Here at the School of Medicine at St. Louis University, we had virtual graduation for our medical students. That was not, I'm sure, how they anticipated their graduation from medical school to look via Zoom. And I think that rather than, it's easy for us to minimize these things and say, gosh, that happened, but I'll deal with it. It wasn't a big deal. It's important to recognize these things and that they do affect us. So when we think about, in ourselves and others, here are some of the warning signs I want to go through that, really indicate to us we need help or somebody that we know needs help. So these are sort of the things to watch out for. A dramatic change in sleep or appetite. Somebody's telling to us, I haven't slept in days, or gosh, I don't know what's going on, but I'm not eating anymore. Mood changes. These can be pretty significant. We see people have changes in personality. The teacher next door is that, from the classroom where I'm at right now, she or he is just not who they used to be. The fuse is a lot shorter. They're behaving in ways they didn't used to. Withdrawal is also another really significant sign that we need to reach out either for ourselves or somebody else. Somebody that is unreachable via text message. They're not returning phone calls. They've really lost an interest in engaging in the world in a way that they used to. A decline in their functioning. This one I always tell folks when they're teetering on whether or not to get treatment for whatever it is I ask them, well, what's your day-to-day functioning like? How is this impacting you? And if you're beginning to think about yourself or others that you're not functioning in the classroom or in your job as well as you used to, or folks are really saying to you, your friendships are struggling, your family relationships are struggling, that's an important sign. Also when changes in thinking abilities. So when concentration seems to have gone out the window, or you're really being forgetful, or logic is not there like it used to be. These, again, are significant signs that maybe it's time to get some help. We also see folks experience increased sensitivity. So we all right now have this sort of elevated baseline level of stress, right? So I think that even in folks that have never experienced depression and anxiety before, we all have this heightened level of just kind of overall yuckiness, distress. But we also can see that during this time, even the smallest of things sort of really throw us over the edge. And so if you see that in yourself or somebody that you're around, that might indicate, it's time to maybe get an intervention. We can also see when we're super stressed out and in need of help that we're even sensitive to sounds, to lights and touch, and really beginning to avoid overstimulating situations. Being in a store situation or in a group of people at a meeting, for example. Another sign that we may need to get some help is apathy. And apathy is that lack of initiative, that lack of drive. I was recently talking with one of my patients the other day, and she said to me, Lauren, I just cannot clean my house for the life of me. I used to be spick and span. That was the pride of me. But now I've got laundry everywhere. My kitchen is a mess. but I'm just kind of not, I don't motivate myself to do it anymore. So that's a marked change, and that's something to be concerned about. And a feeling of disconnection. I mean, certainly right now, I think a certain level of disconnection we're all experiencing as a product of what's happening, but a disconnection in the sense that sort of kind of dissociating, feeling like not really present, even if you're around others. Illogical thinking, so unusual or atypical beliefs. So sometimes people will express during times of significant stress that their thought processes don't seem logical to you. So if you are working with someone or someone that you love, it begins to sort of have magical or atypical thinking. That is certainly a sign that they are in need of assistance from a mental health standpoint. And certainly nervousness, increased suspiciousness, or any kind of odd or unusual behaviors. These are all the important warning signs that someone needs help. And so, you know, what do I mean by needs help? It's really a conversation that can be difficult to have. And, you know, how I often phrase it is, one, it's always good to put the onus on yourself if you're going to approach someone about this. You know, I'm really concerned about you. I think that, how are you feeling? You know, is there anything that I can help you with? Do you need to talk about something? You know, I'm concerned that you don't seem like yourself. It's a hard conversation to have with someone, but certainly necessary. And what do I mean by getting them help? It depends on the person. Some people shut down and don't want to engage in the conversation. But really getting them, and I have resources at the end of the talk, but getting folks in contact with either a support group or a mental health practitioner that can provide therapy, talking to their primary care doctor to see if a referral to a psychiatrist is appropriate. That's what I mean by getting help. So let's think about feeling burned out. And this can happen to all of us, and I think now more than ever, but these are some of the thoughts that you may have that indicate potentially you're kind of getting burned out from a work standpoint. I'm not sure how much longer I can feel like this. I don't get it. I keep working harder, but I never seem to be able to catch up. And these are quotes that I've heard from bunches of folks. Am I crazy, Lauren? Something's wrong with me. If this keeps going, I think I'm going to make an error in my job. So if these are sort of messages either that you're hearing from somebody that you're working with or thoughts that are going through your mind, these are signs that you're likely burned out and also maybe need to kind of step back and reevaluate things. So possible outcomes of burnout, if we don't address it, are, well, just possible outcomes in general. One is that you recognize that you're burned out and change your relationship with your career. And what do I mean by that? This, you're talking to someone, so this is like, you know, the pot calling the kettle black here. So that's my disclaimer for what I'm about to say. But really working on a balance between work and life boundaries is really important. And so that's one way we can change our relationship with our career. And I'll just share personally, when I had a child, I really did change my relationship with my career. I made sure that I avoided as much as possible taking work home with me. And I started to leave at more reasonable hours and get to work at more reasonable hours. And I am by no means saying that that was a simple feat. So I don't want to minimize how that can be challenging. But it's something that, you know, maybe we need to do at a certain time in our lives. If we don't deal with burnout, it could be a chronic condition. And I'm sure all of you that are watching this can think of that person in your mind that you've worked with that's been burned out before. And those are hard folks to interact with because they always seem unhappy, right? Another outcome of burnout is you can suffer a complication. And what do I mean by that? Burnout can lead to depression. It can lead to anxiety. It's been associated with alcohol and substance misuse. So these are all things that if we don't deal with our burnout effectively, these are things that potentially could happen. Wellness is a health matter. You know, taking care of ourselves, managing our burnout, keeping things like depression and anxiety in our mind if we need to be mindful of them, all has to do with our physical and overall health. So I want to now talk about wellness and what are some things that we can do together or independently to take care of our wellness and the wellness of others. And a lot of it has to come from you, really. But wellness is an active pursuit. It's a lifelong commitment to choices and a way of living that really tries to keep ourselves happy and in balance. So this is not new. This has been around for a long time, but it's important when we're thinking about wellness. I think we often think about, yoga or physical activity, but it's really important to realize that it is a multifaceted concept. And really, there's 6 domains of wellness that we can talk about. One is occupational. So the central premise here is that has your career, is it in line with your values as a person? So is your career feeding your soul, essentially? Having skills and functions that we can transfer to other opportunities is really important. So that's occupational wellness. Physical wellness is pretty self-explanatory. Are you taking care of yourselves? Are you eating well? Are you hydrating enough? Are you getting enough movement? I think the piece that oftentimes we miss is that it also includes medical care. So getting a physical. Physical examinations are very important. And I think it's the one thing we kind of throw by the wayside every year. Oh, I'll put it off. But it's all a part of our wellness. Social wellness. Do we feel like we're contributing to the environment in our community? Discover what in your life is important to you and use it to enhance personal relationships and friendships. Intellectual wellness. What do you like to do that mentally stimulates you? And here's where I've had people say to me, do I need to go out and learn a new instrument or a new language or pick up a kind of art that I'm not interested in? The answer is no, unless it's what you want to do. So some folks really are like, you know what? I've always wanted to play the piano. Well, go do it if you can. But do something that stimulates your mind. Spiritual wellness. This is where we're thinking about searching for meaning and purpose, not necessarily specific to a form of denomination, but how are you feeding your soul? And I love this quote from Dr. Hetler. It is better to live each day in a way that is consistent with our values and beliefs than to do otherwise and to feel untrue to ourselves. Emotional wellness. This is being aware and accepting of our feelings. I said a bit ago that it's okay to not be okay. It's really important for us to have realistic expectations for ourselves that includes an actual assessment of where our strengths, where our weaknesses, and how do we cope with stress. And it's really important for all of us too to recognize that we all experience a wide range of emotions and it's okay to not be okay, right? Another really important part of emotional wellness is getting help when you need it. Reaching out to a therapist if it's necessary, calling your primary care doctor and saying, gosh, I'm not feeling like myself. What are your suggestions? So what can we do to help improve our wellness now that we know sort of what those domains are? So one thing to do, and I'm going to encourage everyone on the call to engage in an exercise with me in just a minute, but I want you to think about resilience. Resilience is the process by which we adapt in the face of adversity to trauma, tragedy, difficulties, and how do we bounce back from that? So I want you just to take a moment, wherever you're watching this right now, and think about how have you been resilient during the pandemic? Even if it's something small, it doesn't have to be grandiose. I'll share mine. I hatched chickens during the pandemic, and I never thought I would be raising chickens. But for me, I pushed myself to do a new skill, and it was really awesome, and I really am still enjoying it. But if you would have asked me a year ago, Lauren, are you hatching chickens? I would have looked at you funny. So I felt like that was a resilience for me. And I bet I would love to hear all of your resilience. I'm sorry that we're not together in a room doing this, but I'm sure you all have really great examples about yourselves. Factors that contribute to our ability to be resilient include having supportive relationships. And that's really hard right now, I know, to maintain those, but texting, getting on the phone, FaceTiming, whatever it is on whatever tech platform for you, but keeping in contact with people. Another factor that contributes to our resilience is the capacity to make realistic plans for ourselves and take the steps to carry them out. We also have to have positive views of ourselves in order to be resilient. We have to be able to communicate and problem solve. And this one I like a great deal. We have to have the capacity to manage strong feelings, and that can be really hard. So how do we deal with all of this stress? Here's the easy answer, right? Lower the amount of stress levels. And that's where Einstein's saying no duh down there. Increase our ability to recharge our energy account. Well, easier said than done. So I put this slide up here and it seems a little busy because now we're going to talk about how do we recharge our batteries and how do we sort of take care of our minds so that we are more well. So this slide is busy because wellness is not a one-size-fits-all deal. And I always say to people, there's no judgment here. For whatever it is that you need to do or your friends need to do to take care of themselves, go for it. I have people that I know that are bakers. I have musicians. I've got journalists. People love to journal. I've got people that are into exercise, listening to music, whatever it is. Do what makes you feel better. Of course, that is healthy for you, but there's no judgment here. If you need to watch some bad television for a little bit, that's okay. We all need an outlet, right? And so let's not judge each other and not judge ourselves for whatever that outlet is. So let's talk a little bit about one of our biggest inhibitors and barriers to wellness is stuck between these ears right here, our own inner critic. So we're going to talk about taking out the head trash. So the first thing I think to recognize is that we're going to all experience burnout from jobs, relationships, whatever it is. It's important to recognize it's something that we manage. It's not a problem that we solve. So if our feelings of burnout and kind of just exhaustion was a problem, that means we would do something, fix it, and then it would go away. But that's why I say it's a dilemma, because a dilemma is something that we manage throughout our lives and we learn skills to take care of it. So we're all conditioned in certain ways to be workaholics. You know, I can do everything. Emotion free. I can do my job. It's not going to affect me. Being a teacher, I'm sure, and I teach at the medical school level, is hard. It's stressful, you know, but I can do, it doesn't affect me if I had a bad day today. If my lecture didn't go well, it doesn't affect me. That's not true. We're also ingrained to be superheroes. The Lone Ranger, that means, you can do everything on your own. And certainly nobody on this call knows what a perfectionist is. I say this in jest. But really kind of thinking about how do we combat some of these internalized personality structures, if you will, that we've developed over time. So our self-talk is where to start. So saying to myself, it's okay to take care of my personal needs. It's okay that I'm down and struggling. It's okay to delegate. It's okay to ask for help. And sometimes good is good enough. So we really have to work on taking care of that inner critic. So one thing too that we can do is mindfulness. Mindfulness is a skill set, and people practice mindfulness in many different ways. But it's a very simple to learn, hard to practice skill set. So mindfulness by definition means that you're quieting your mind as best you can and focusing on one thing at a time. So the first thing you do during mindfulness practice is notice that you're not present, that your thoughts and your feelings are distracted. So for example, you're doing an email, you're looking at your phone to respond to a text, and oh my gosh, wait a minute, I'm not fully present right now. So I noticed that. And you have to do it in a non-judgmental way. So rather than beat yourself up about it, you just acknowledge, oh man, I'm really distracted. So I release those thoughts and feelings without judging myself. And then I try to return myself to the task at hand, one thing at a time. So mindfulness really is you can decide, some folks like to do guided meditation. There are great apps you can get on your phone like Headspace, Pacifica. calm.com. Some of them have free versions, so you don't have to pay for them. But mindfulness really is about quieting your mind as best you can. And the good thing about it is if you're experiencing a moment of anxiety and you're with other people, people don't notice that you're doing this. You could just take a moment to watch your breath for a minute. Try to quiet yourself. I teach students this for test anxiety. Nobody knows that you're doing it, but you are taking care of yourself in that moment. We all have experienced what are called maladaptive automatic thoughts. So I am a cognitive behavior therapist, and cognitive behavior therapy trains us to try to, when we're depressed or anxious, really critically evaluate the negative automatic thoughts that we could be sending to ourselves. And I'm going to show you an exercise in a moment of how to do that. But some cognitive distortions that have been happening a lot around COVID are the following that I have listed. One is that we sort of are developing inaccurate risk assessments. So when I've had some folks that have become so paralyzed by their fear of just even coming out of the home for small things such as getting their mail. That's an extreme example, but it's stuff that I do deal with. Working on having an accurate risk assessment. What is the evidence for or against that will happen? We also are engaging in catastrophic thinking. This is never going to go away. This is never going to get better. Well, what is the evidence for that? We have experienced, not in our lifetimes, but as a human culture, there have been other pandemics and they have been survived. I'm also seeing folks, particularly too, that are working from home, maladaptive perfectionism in the sense, especially folks that have kids running around the house, so like they have to be the perfect parent and the perfect worker all at one time at home. And so really trying to release that. Today I'm going to be good at this. There's no way for me to be perfect at every single thing that I do. And we also do a lot of shoulding on ourselves. I should do this. I should do that. And if you find that you're doing that, that really means you're not talking to yourself like a friend. And it really can lower mood and heighten anxiety. And I would say that if you hear folks that you're working with too, doing some of these things, say, hey, let's all have grace right now. Have grace for yourself and those that we're working with, because it's such a stressful time. So here's how cognitive behavioral therapy works. So we have a situation or a trigger. For example, I didn't complete my lesson plan for today. And the automatic thought might be, for example, gosh, I'm no good at this teaching gig. I'm never going to be good at this. And the emotion that then might happen is feelings of sadness. And so what cognitive behavior therapy teaches us to do is challenge that automatic thought. Well, what's another thought that you could have instead of I'm not a good teacher? Something that's more neutral. Well, maybe it's that you had too much on your plate today and nobody could have finished the lesson plan today. So then rather than feeling sad and down, maybe the emotion is like more neutral, right? So this is about CBT. We look at our thoughts, we challenge them in the hopes of trying to improve the emotional state. When we're talking about coping with grief, I think it's important for us to recognize that when we're in pain, no matter how much pain you feel, we will survive the losses. And I'm not just talking about death here, remember, loss in general. Ups and downs are a normal part of the grieving process, and we have to get through them, otherwise they don't go away. Don't try to speed up your feelings. There's not a timetable of how long it's going to take you to feel your grief for whatever loss it is that you've experienced. Care for yourself as if you would a friend during your time of grief. Make sure you're resting, eating well, and exercising, like I talked about when we talked about the domains of wellness. I think it's really important when we are in a state of emotional distress, be it grief, depression, or anxiety, to hold off making big changes in your life if you can avoid it. Don't make big decisions unless you have to. Look to others in your life. You don't have to do all of this alone. And journaling can be really helpful too, writing about what you're experiencing, expressing your emotions in that way. And really, like I said, part of our wellness is knowing when we are unwell. And so I think I kind of want to end here with I think it's all of our responsibility to try and destigmatize mental health as much as possible. Remember, 1 in 5 of us have a mental health concern compared to 1 in 10 have diabetes. So the odds are that you know a good number of people that are quietly suffering, or you yourself are. And so I think it's important for us to think about, how do we destigmatize it? How do we talk about mental health? And I use this cartoon because I think it really accurately summarizes why a lot of us are afraid maybe to take that step forward to get help. I'm afraid I'm going to be judged. People won't be understanding. It could hurt my career. I don't want pity. I'm scared it will define me. But I encourage you to come forward if you're suffering, or come forward if you feel like you have someone that you know is suffering. So some resources for you. St. Louis Behavioral Medicine Institute is a wonderful group of therapists here in St. Louis that are doing telehealth services, which I think is great. And then I have a list of lots of other stuff like NAMI, different other therapeutic outlets if you're needing to find a therapist. Mental Health America has really specific recommendations for different things during COVID. And, you know, obviously, like I said earlier, thoughts of not wanting to go on is clearly an emergency. And so here are emergency lines. If you feel this way, or if someone that you're working with or somebody that you love is experiencing those things. So what I'd like to do for just a moment is do a little mindfulness exercise with you guys. So if you will entertain me, I'd like everybody to sit quiet and still, and we'll do this together. Sit still and quiet. Relax your muscles, your eyes, and your mind. Listen to the sound of your own breath and to the wind, the earth's breath of life. Listen to the movement of the trees on the ground, a mockingbird, a dove, or a distant train. All of the sounds blend into one, and then they fade away. If you sit quietly enough, you will hear the beating of your own heart. Breathe. Let your mind flow away like a river without beginning or end, like the waves rolling up and down the shore. You are part of the river. You are one with the ocean and with the wind. You are your thoughts, your words, your breath. You are alive. In the distant quiet, there are no bills to pay, no papers to shuffle, no rules to obey, no bad deeds to regret, no wrongs to right, and no good left undone. In this moment, worry has been replaced by contentment, confusion by understanding, fear by courage, and agitation by calm. In this place is you. In this place, you are remembering the miracle of your own life. When you come back to thoughts of your body, to your responsibilities, all you need to do is to remember to take part of this simpler you on your journey in the world. So with that, I leave you. It has been my distinct pleasure to talk with you through some of these things. I hope it has been helpful. And I look forward to sharing more time with you over the course of the year. And my understanding is that some of these will be done sort of as live webinars. So I'll be able to answer questions. And I wish you all wellness for you, your families, and your loved ones, and your students. Take care, and thank you for your time.